that old-fashioned clinicians like me, who followed Sir William Osler's addictive, listen to a patient. Listen, he's telling you the diagnosis. It confirmed that I am fast becoming a member of an endangered species. The voting this afternoon suggested that less than 20% of people, not only in this room, but those who have registered for this conference, for 2 days, 14 hours, they are spending on transforming healthcare. I shudder the day when my grandson and when my great-grandson, with all respects to the PhDs, the MBAs, the health economists, Professor Yungkap Kwankam and people like you, sir, you have done a fantastic job in bringing health to the world. But for my grandson and my great-grandson, I'm not interested in personalized medicine. I'm not interested in P4. I'm not interested in the genome. I'm not interested in the microbiome and so on. I want a clinician, a doctor, to decide whether the meningioma which I have, if I do a CT scan for everybody in this audience, I'll stake my reputation that all those above the age of 55, 60 will have multiple cervical discs. Technology is going to pick up so many things, and I shudder the day which is already happening when people are going to be treated by computers. Andy Fisher, the president of ISFTH, and some other speakers said that in Kaiser Permanente, a machine picked up a patch which a human radiologist missed. Does it mean that patch has to be treated? People die with meningiomas. People do not die of meningiomas. I have been in active neurosurgical practice for about 37 years. I love technology, otherwise I wouldn't be here. But ladies and gentlemen, I would like to quote what the inventor of the gamma knife, which at that time was the world's most sophisticated tool, he said last lecture, and I repeat, a fool with a tool is still a fool. Now I think this is very, very important. Now look at this, look at what Steve Jobs said. Steve Jobs said, I'll simplify a lot of tasks. He didn't add, you never had to do before. Just because technology helps us solve a problem does not mean, sir, that there was a problem in the first place. You devise a technology and you go in search of an application. That's what, with all respects, the MNCs, the Microsofts, the Googles, the Sun Microsystems, all the big companies. You devise a technology and then you go hunting for an application. That's what you do. You come up with fantastic theories. You say this fever could have been due to that. So why not I do an immunological study? Suppose, how can you exclude? A PET MRI is much better than a PET CT. So let's do a PET MRI. And so on and so forth. Because I don't think it's good for my going on like this. But anyhow, when I started as an assistant professor, the word genome was coined. Do I really want to know about the microbiome, which is what is possible today? I have trillions of commensal bacteria existing in my intestines. That is why I'm alive today. Otherwise, when I take an antibiotic, I obviously have to supplement it with microbial agents. Do I need to know about diseasome, environmentome, I can't even pronounce this, and so on and so forth. This is the world of today. Always on health information gadgets. I'll give you a simple example. If I was wearing a wearable technology, right now my blood pressure is 280 by 140. I'm scared of the boss sitting here. I'm scared of all the people here. My pulse rate is probably 240 per minute. Now some big computer out there is measuring. We were shown that this morning. But he doesn't know that I'm giving a talk. He doesn't know that there are 200 people in front of me. And what does he do? He says, this guy has got supraventricular tachycardia. His pulse rate is 280 per minute. Come on, start quickly. And before I know, a drone comes from somewhere, takes out of this thing, an ambulance comes, picks me up, takes me, defibrillation takes place. I'm taken to an ambulance. Why? Because there is solid scientific evidence that I've got supraventricular tachycardia. But the reason behind, ladies and gentlemen, I'm an old-fashioned doctor. I have treated thousands of headaches. When a patient comes to me for headache, I say, okay, are you married? How long have you been married? Is your mother-in-law living with you? These are the questions I ask. Now, this is what is important, and I am worried. I am worried that the clinician of tomorrow, who's an expert carpenter, a superb plumber, a fantastic electrician, yes, But do we need that stenting? Do we need that bypass surgery? How many of us really evaluate the natural history of an untreated condition versus option A, option B, option C, and option D? And just look at this slide. Advances in predictive, preventive, and personalized medicine. But at the same time, there are other books which say mind matters, working with emotional intelligence. All of us know that Harvard Business School is one of the most reputed organizations in the world. We all talk of data analytics. We talk of big data. I'm also equally familiar with it. But just listen here. Fortune 500 companies, Fortune 100 CEOs use their gut feeling as much as complex data analytics. Ladies and gentlemen, acquisition and mergers costing $100 million, $1 billion is based quite often on your limbic lobe. Or I can give you a big lecture on the nucleus accumbens septi, which in the brain is responsible for this. But nevertheless, it is not only on big data and analytics. Meditation encourages divergent thinking. Clearly, emotional intelligence is a sine qua non of leadership. Without it, a person can have the best training in the world, an incisive analytical mind, an endless supply of smart ideas, but he still won't make a great leader. I want to just show you 3 examples from my clinical practice. Here is a patient whom I saw in 2008. My special area of interest was stereotactic radiosurgery, and thanks to the management of Apollo hospitals, I was able to start this, also the cyber knife. Now here is a patient with an acoustic schwannoma. I would never have done an MRI at all. A secretary to a chairman of a big company, one single episode of giddiness. So what? That's what I would have treated. But they did an MRI, they picked up an innocuous, non-symptomatic tumor. I was forced by people who read Professor Google and Dr. Facebook to do radiosurgery. But it was against my conscience. I said, no, I'll follow up. 8 years later, I've still followed up, and hearing is preserved. She's absolutely fine. She's living with that brain tumor. I've got many patients like this. Here is a patient whom I saw in 1998. A young girl, at that time 18 years old, today 36. The only problem she had was, you can see a deviation of the eyeball to one side. Of course, as a scientist, I kept close track of her vision, her visual acuity, and so on and so forth. And you can see an illustration of clinical judgment and wisdom. No treatment. Just because I have the technology, just because I have the facilities, just because I can afford to do it, I don't think you need to intervene. Non-intervention is much more difficult. I remember Narasimha Rao's photo on Time magazine which said, a decision not to take a decision is an important decision. That is what Narasimha Rao said. Many problems in the world get solved by efflux of time. If a patient is critical, don't jump. Wait for 6 hours, he'll die, and the problem will be solved. Or the very fact that he has survived for 6 hours, I will go all out, intubate him, ventilate him, and do everything possible. Clinical judgment and wisdom, this is what is required. A patient with a huge cerebral arteriovenous malformation. 17 years I have been following up this patient. Now here it is not no intervention, here it is partial intervention. I have done 2 stages of radiosurgery. Patient gets an occasional headache. I give paracetamol, crocin. The other doctors think, why did I come to this doctor, Apollo, big doctor in Apollo, he has prescribed crocin. Did I need to go to a doctor like this to prescribe paracetamol? That is what the patient thinks. But then this is the real fact of life. Now look at this, causes of death. Third commonest cause of death, ladies and gentlemen, is me. The doctor, the hospital, the third commonest cause of death. And when doctors don't listen, avoid misdiagnosis and unnecessary tests for lack of time, I could go on and on, but this is what it is. Do I want a 12-year-old girl to have a bilateral mastectomy prophylactic because there's a 99.8% specificity that she has got the BRCA gene? Where is the patient? Search for the patient. Oh, somewhere there, the patient is there. Is this what you want? Yes, it's important. I'm not saying no, but do we need to do this for everybody? Ladies and gentlemen, we are in a stage of transition, and this is what is the most difficult part. Now, we just don't know what is normal blood pressure for a 100-year-old because there is no data, no analytics. What is normal urea and creatinine for a 90-year-old Indian? So just because it is 85 urea doesn't mean he needs to go on dialysis. I could go on and on. But so, ladies and gentlemen, the ideal clinician in 2020 should be a combination of Shushruta, the compassion of Mother Teresa, which technology is killing. the pragmatism of Lord Krishna, the genius of Albert Einstein, of the innovation of Steve Jobs. All this together makes him a superman. Now this is what? This is a slide which I love. This is a true picture of a neurosurgeon in the United States doing a spinal surgery, fetal neurosurgery, and you can see that after the meningomyelocele is repaired, that's a gravid uterus, a full-term uterus. Just look at that baby with its fingers clutching the hands of the neurosurgeon, almost saying, "Thank you, doctor, you saved my life." I think it's important that we do not lose sight of this. And I think, what is my take-home message? The UNCAP Quancoms of the future, while necessary, cannot, should not, and will not replace the Ganapathys trained primarily as clinicians with some exposure to technology. EBM, algorithms, flowcharts, protocols, SOP, big data analytics, access to Watson, give suggestions, yes, to be used by an empathizing clinician who alone should take the final call. EQ, emotional quotient programmed artificial intelligence, can never ever substitute the God-given limbic system. Management plan customized should factor history, geography, socioeconomic status, natural history vis-a-vis different interventions and clinical competence. Having said this, of course we require evil. We require Dr. Yunka Quancom, because unless there is evil, there cannot be good. Thank you, ladies and gentlemen. I rest my case.